Welcome to our presentation on National Competitive Bidding. This presentation has been produced by HME Professional. HME Professional is a trusted national consulting group to the home care industry. Our services include business development, compliance and accreditation preparation, and education. More information is available at www.hmebiz.com. This is the first of a two-part series about national competitive bidding. In this first part, we will discuss the requirements the provider must meet to compete in the bid, how Medicare will evaluate the bids, how they determine the winners, and how they set the prices. In the second part of the series, we talk about the bid application process, Forms A and B, and the mechanics of submitting the application and the bid amounts using the tools provided by the competitive bidding program. This presentation is meant to be a primer to understand the competitive bidding process. Most of the information is from Medicare's Request for Bid Instructions published for the Round 1 rebid, now called Round 1.2, conducted in the fall and winter of 2009. If you are familiar with the Request for Bid Instructions and the bid evaluation process, you know that Medicare is very precise in using particular terms or definitions in their instructions. If you would like to obtain your own copy of Medicare's Request for Bid Instructions, it is available at dmecompetitivebid.com. There is absolutely no guarantee that some of these instructions will not be modified between the time of this writing and the Round 2 bidding scheduled to proceed in 2011. However, if the program continues, it will likely be modified in relatively small detail. National competitive bidding has been described by CMS as a way to save the program money and reduce the number of suppliers. It appears that it will accomplish its intent, as with the results of the July announcement, 364 providers were selected. In 2008, it was reported that an estimated 4,000 providers participated in providing medical supplies and equipment in the same areas. How that is competitive, frankly, I'm not sure. Many in the industry see NCB as a secretive, flawed program that uses statistical trickery to confuse suppliers and plays upon small businesses, fearing for their lives, to enter ridiculously low bids. Bids so low, they argue, that businesses cannot actually sustain at such rates. This could be true. But neither of these issues is the point of this presentation. The point of this presentation is education. Section 1847 of the Social Security Act, as amended by the Medicare Prescription Drug Improvement and Modernization Act of 2003 and the Medicare Improvements for Patients and Providers Act of 2008, requires the Secretary to establish and implement a Medicare Durable Medical Equipment, Prosthetics, Orthotics, and Supplies competitive bidding program. The competitive bidding program replaces Medicare's current fee schedule methodology for determining payment rates for certain DME POS items in the competitive bidding areas. National competitive bidding is the law, and while we may be hopeful that it's stopped or changed and we may participate in those efforts, it is still the law. Hope should not be your only strategy. I encourage all providers to get as much information about NCB as is available. Watching this presentation is a step to that. I encourage providers to read. Organizations such as HME News publish breaking news, opinions, and commentary on events and changes in the industry. Also, watch the CMS website and dmecompetitivebid.com for official information, updates, and changes to the bidding process. Listed is the schedule of events for Round 2 of competitive bidding. At the time of this writing, CMS intends to conduct the bidding process in 91 more competitive bidding areas in the same fashion that it conducted the Round 1. These competitive bid areas, or CBAs, will cover about 64% of the people in the United States. CBAs differ from MSAs, or Metropolitan Statistical Areas, in that CMS is currently using zip codes and not necessarily county boundaries to define these areas. Additionally, very large areas, such as Chicago and Los Angeles, are going to be subdivided into multiple bidding areas, as few providers are able to cover the entire metropolitan geography.